Fighting the pandemic is a global priority, and the World Health Organization is coordinating efforts to ensure vulnerable and underserved populations aren't left behind. My next guest, really cool, is the chief scientist at the WHO. Welcome, Dr. Soumya Swaminathan. Swaminathan. So I apologize. I have been abroad and had encounters with Dr. Tedros and the WHO. America is back in the WHO now, and so this is a punctuation point for that. Tell us about, we were just discussing with Dr. Fauci and Dr. Clemons, the global scene. What do you need right now so that we make sure that every corner of the world is vaccinated in this tough time?
Thank you so much, Steve. It's very nice to be with you. And as you rightly pointed out, I think we are really at a very critical moment in this pandemic because the first few months, were really confusing for everyone. There was a lot of scientific work going on, of course, as Francis was just talking about. And that has resulted in this unprecedented sort of situation we find ourselves in, where we have not one but several vaccines that have been developed. We have other tools, we have drugs in development, we have diagnostics, and yet there is this inequity around the world that we see where some countries are moving ahead, vaccinating their populations while other countries are desperately waiting to have access to these tools. We do believe at the WHO that the pandemic cannot be won one country at a time, that we need global solidarity and cooperation. And it's not just a moral argument that we are making, but which is, there is a moral and ethical argument, but it's also a very practical and economic argument because it's very clear that even if high-income countries manage to populate their populations, vaccinate their populations, that they will not be able to get back to normality till people in other countries are vaccinated as well. So, there are trillions of dollars attached to this global trade that will not recover until people everywhere are protected. So our plea is, let's first protect the high-risk groups, the vulnerable people in countries around the world at the same time, the healthcare workers and the elderly and others at high risk, so we can prevent those deaths that might otherwise occur in the months ahead of us.
Dr. Swaminathan, I know that organizations like yours are not there to replace the marketplace, where things are going well. You're designed to take action in places that aren't going well. And I guess, in other organizations, I know this is not in your terrain, but CEPI, the Coalition for Epidemic Preparedness Innovations, big fan of what CEPI does. Or you look at COVAX, which countries have been, donating for to make sure that there is a equitable share of global vaccine distribution. I was appalled when I saw the United States gave $20 million to CEPI when billions upon billions of dollars are needed. I want to give you an opportunity. Maybe you need to take your WHO hat. What does the developed world, including America, need to do by way of dollars to help you achieve your mission of getting vaccines into these places that don't have the resources?
Yeah, I think that's a really good question. And the reason that WHO, along with Gavi and CEPI and many of the other big global health players, actually initiated and started the ACT Accelerator and the COVAX facility way back in April of 2020 was to do things differently this time than the world has done in the past. We've had the situation with HIV, for example, where it took 15, 20 years for Africa to get access to the drugs. And meanwhile, 12 million people died of HIV before the drugs that, were available to people in the rich countries, could be made available in Africa. And similarly, we saw in H1N1 that the rich countries actually, really captured the market for drugs and drugs and vaccines. So we set up COVAX to promote R&D, which is CEPI's primary responsibility, so that we have as many new vaccines as possible, but also to ensure equitable access. And the whole idea was that the world would come together and would work as one in order to tackle this pandemic. And where we are today is, as I said, it's a very critical time because we still have an opportunity to turn this around. What we would like countries like the US to do is invest in COVAX, and I'm very, very grateful to the US for having made a commitment of $4 billion. Apart from the commitment they've made to CEPI, so they've actually made the announcement for $4 billion investment into COVAX, which will help to buy vaccines for the low and middle income countries. But beyond that, it's not just a question of money. It's also a question of know-how and technology and the tools and sharing of that know-how, building capacity in the countries for manufacturing some of these products, which don't currently exist, and also sharing the scarce supplies. In the first few months of 2021, we see around us now, there's a desperate need for vaccines in every country. And we have, heads of state calling the Director General every day saying, people are dying, can you not help me? And we are almost in a helpless situation. So we can share because we do have countries that have more than enough vaccines to protect their vulnerable populations and beyond. And this is the time actually to show that solidarity by saying, let's share with people in other countries who need it now. And the rest of our population can actually wait a little bit till the supply-demand equation changes. And that will change in the second half of 2021. There'll be much more supplies available then to start vaccinating, healthy people in the population.
You exist in such a high-stress situation. When I last connected with Dr. Tedros, I was at the Bratislava Forum in Slovakia, and he was there, and he was sort of talking about all these different events. I would never want his job, membership organization. You're a membership organization, right? People don't remember that. But when I want to ask you maybe an uncomfortable question. We're very narcissistic in America. We're talking a lot about Moderna and Pfizer and Johnson & Johnson and what they're doing. But there are a lot of other vaccine developers going on out there. Do you have any worry as the chief scientist of the WHO about an unevenness in the vaccines? Or should we feel confident that if China develops a vaccine, Russia develops a vaccine, Abu Dhabi's buying some of those vaccines, that as you kind of look at a lot of different tracks to vaccine development, are you confident that the scientific platform is steady, or do we need to worry about wobbliness?
This is a great question as well. This is why right from the beginning, in February of last year, 2020, we actually convened a large group of global scientists and developers, including the private sector. And we started tracking vaccine development. So we maintain on our website a landscape of vaccines. Currently, there are over 200 vaccine candidates in development and about 65 of them in clinical development now, which is just amazing. But we want to, exactly as you say, everyone must have an equal chance. And so we have these networks of experts. I was on a call this afternoon where they were discussing the latest on immunology. And it's very democratic. You have people from all over the world participating in these calls, sharing information. That's been one of the high points for me, is seeing the openness in the scientific community. And we have a process to determine, we've set benchmarks, we have target product profiles, we invite the data and dossiers from companies from around the world. So currently we are looking at, half a dozen dossiers, not just Pfizer and Moderna and AstraZeneca, but also the Sinopharm, the Sinovac. We're talking to the Russian, the Gamaleya Institute, and we're waiting for others, actually. And also providing support to those who may be later on in development. It is going to be challenging to do all these randomized clinical trials, but we need more vaccines. We need mucosal vaccines, nasal sprays. We need single shot vaccines. We need vaccines that can be stored at room temperature so they can be distributed in the developing world. We need vaccines that are, safe and easy to use in pregnant women. So we want to promote as much as possible the development of more candidates. And with the new variants and the mutations that Dr. Fauci was talking about, it is possible that, we're going to have to look at different models of vaccines. So the WHO provides a platform for everyone around the world to come up with ideas, come with their products. And then, of course, it's a question of, do you meet those standards of safety and efficacy and quality? And if you do, then, we provide an emergency use listing, and we also provide the policy guidance through the expert mechanisms we have. We have something called SAGE, which is the group that provides the immunization advice, and that many, many countries depend on WHO guidance to adopt it into their own countries. So we believe that we have to continue to develop more vaccines, even as these early ones get rolled out.
Well, Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization, I really appreciate you giving an unvarnished look at the challenges we have and about your own concerns. This is an obsession of mine and also the Hills, but I want people to understand that, science matters, but you got to invest in it. You got to look at, how you deploy it. And you need to look at it, how to make it fair and equitable. We have, Representative Eddie Bernice Johnson. We're going to continue that conversation with her in just a moment about how to get these elements right. So thank you so much for joining us.
Thank you very much.